Nicole Anthony Shavers. I was told recently that I might be insulin resistant because despite working out and watching what I eat, I'm not dropping weight like I should. Is that the same as diabetic? And how do I address it? Well, insulin resistance is a pre-diabetic stage, and if you have a family history of diabetes, you have to be very conscientious about that. It's usually associated with having a little extra body fat, particularly in your hips and thighs. There's a syndrome called the polycystic ovary syndrome that is associated with this as well. But what happens when you're insulin resistant is that your peripheral muscles and fat are not metabolizing sugar the way that they should, and they're not responding to the insulin challenge when your pancreas puts insulin in your circulation that helps you metabolize sugar. And when it takes the higher doses of the insulin for you to dissolve the same amount of sugar, that ultimately results in higher blood sugar levels and diabetes. So when you are insulin resistance, that's one of the terminologies that can be used, particularly if you have central fat, like I said, hips and thighs, abdominal fat. You have what's called a pear shape versus an hourglass shape, a pear shape where you okay from here, but as you move further down your body, you start to have and hold on to more body fat. So insulin resistance is, again, you can help defeat that with weight loss, particularly decreasing the amount of body fat that you have. And that is where the products like the Lipodrops Max come in very well because they help your body metabolize peripheral body fat.